Many people assume that once they enroll in Medicare, most of their healthcare costs simply disappear. The truth is a little different. Medicare can provide valuable coverage, but it doesn't pay for everything. In fact, some of the biggest retirement expenses come from the costs people never expected. Today, we're breaking down the Medicare gaps that catch retirees off guard and what you should know before they turn into expensive surprises. One of the biggest misconceptions is thinking that covered means free. It doesn't. Even when Medicare covers a service, you may still have to pay monthly premiums, deductibles, copays, or coinsurance. Those out-of-pocket costs can add up quickly, especially if you visit multiple doctors or manage a chronic health condition. For example, Medicare Part B covers many outpatient services, but beneficiaries are still responsible for the monthly premium and deductible before Medicare begins paying its share. Even after that, you'll often owe a percentage of the approved cost. That's why it's always smart to ask what you'll actually pay before scheduling a test, procedure, or treatment. Prescription drugs can be another costly surprise. Original Medicare doesn't automatically include most outpatient prescription coverage, which is why many retirees enroll in a separate Part D plan or choose a Medicare Advantage plan with drug coverage. But not every medication is treated the same. Every drug plan has its own formulary, a list of covered medications. Your prescription could fall into a lower cost tier or a much more expensive one. Some medications may require prior authorization or step therapy before they'll be covered. Even the pharmacy you choose can affect the final price, so comparing options before filling a prescription can save more money than many people realize. Long-term care is another area where expectations often don't match reality. Medicare may cover certain short-term skilled nursing care or home health services when specific conditions are met, but it generally does not pay for long-term custodial care. That includes ongoing help with everyday activities like bathing, dressing, eating, or moving around safely. The same applies to many services that help people remain in their own homes. Medicare usually doesn't cover around-the-clock in-home care, housekeeping, meal preparation, or personal care when that's the only assistance someone needs. Understanding this difference ahead of time can help families prepare financially before a crisis happens. Many retirees also assume Medicare Advantage plans eliminate every coverage gap. While these plans often include extra benefits, every plan has its own rules. Provider networks, prior authorizations, referrals, prescription coverage, and out-of-pocket costs can vary significantly. A lower monthly premium doesn't always mean lower overall healthcare expenses. Extra benefits like dental, vision, hearing, fitness memberships, or transportation can certainly add value, but they often come with annual limits, provider restrictions, or coverage caps. Before choosing a plan, make sure those benefits actually fit your healthcare needs rather than simply looking attractive on paper. Dental, vision, and hearing care deserve special attention because original Medicare generally doesn't cover routine services in these areas. Regular dental visits, prescription glasses, eye exams, and hearing aids can become major expenses during retirement. Some Medicare Advantage plans offer partial coverage, but benefits and limits vary widely, so reviewing the details each year is essential. If you enjoy traveling, don't overlook another important gap. Original Medicare generally provides very limited coverage outside the United States. If you're planning an international trip, a cruise, or spend part of the year abroad, verify exactly what your plan covers before you leave. A medical emergency overseas can become extremely expensive if you assume Medicare travels with you. The bottom line is simple. Never assume Medicare automatically pays for every healthcare expense. Before receiving care, filling a prescription, or selecting a plan, take a few minutes to confirm what's covered, what rules apply, and how much you may owe out of pocket. A little planning today can help prevent a very expensive surprise tomorrow. Which Medicare expense do you think surprises retirees the most? Let us know in the comments below. If you found this video helpful, don't forget to hit the like button, subscribe to the Untold Compass, and share this video with friends or family who are planning for retirement. Thanks for watching, and we'll see you in the next video.